So Casey came to us when he was 9.5 years old, and he had no diagnoses at that time. He was referred by the orthopedic surgeons for an evaluation because of behavior problems and perhaps some developmental issues. So on our initial evaluation, we met Kirsten and Casey and did a history of physical examination and developmental testing on him. And the history was suggestive of attention deficit hyperactivity disorder, or ADHD. But in addition, he had several other diagnoses, and some of these involved adverse childhood events that occurred to him, including neglect and abuse. And so he also may have been exposed to toxic substances in utero while he was developing. And so many of the behaviors that he was manifesting were a result of these prior experiences as they affected his brain. We discussed this with his family and were able to arrive at an initial plan. We're still in the beginning stages of therapy, but I felt Casey has taught us all something very important, that we can come from a situation which may not have been optimal early on in his life, and we can arise from that and still become a successful individual that is able to reach their potential.
We originally came to Shriners to help Case with an orthopedic need. He was struggling with his arm, and our pediatrician recommended that we come to Shriners to see an occupational therapist. You know, we started coming for an orthopedic need, and as soon as we saw the first doctor here at Shriners, she immediately said, you know, I think we need to look a little bit further because this is a neurological related issue that is potentially a birth defect, and there are potentially some other neurological needs that we need to look at. And you know, we came here looking at his arm, but what we found in the end was that there was so much else going on that we needed to tackle and to deal with, and we just really weren't even aware of the depth of the situation. He started to address some of the neurological and impulsivity issues that Case was dealing with, and started talking with us about maybe some of the ways that Case's brain was wired in a little bit different way, that he thought he could offer help. He not only set us up with a clinical psychologist, but also got us started just making progress with the school system and filing for testing and getting the ball rolling in so many other ways that I hadn't been able to do up to that point. And I'd struggled so much with it, but Dr. Lee just said, no, these are the issues we need to address, and this is how we're going to do it. Yeah, Case struggles with making quick decisions without thinking about them. So if he sees a red bouncing ball in the street, he will run after it. And even though he knows that a car is dangerous, or he knows that streets are hard to watch for cars, he still tends to jump after the ball. He still tends to put himself in dangerous situations physically and his siblings, because he's not always sure of the right decision. Yeah, from the first day we came to Shriners, we saw the fish and all of the incredible places, and just the way that the hospital's clean and decorated, and we just felt so lucky to be here. We knew that Shriners was an incredible place because of the care that we were given, from the nurses to the x-ray tech. Remember x-ray Jake? Just all of the people that we have come encounter with have been so helpful. Not only helpful in just this is what we need to do, but even predicting the next steps and following through to make sure that they happen, getting us connected with people in our community that can help us. It has been such a blessing from the very first day. Put into play. But Dr. Lee, every time we meet with him, talks with Case and says personally to him, while he looks him in the face and says, Case, how are you doing with impulse control? How are you doing in relating to your family? He asks personal questions that Case knows that Dr. Lee is caring for him and not just giving him a quick answer or a quick fix with a medicine. It's none of those things. He started with the first steps of come in and talk to Case and see what his needs were. His next steps were to get involvement with the counselor to deal with the emotional needs as well as the neurological needs. He then worked with medication. Knowing that I was a little bit fearful about it, he really sat down with me and spent the time to say, these are your options, this is what I recommend, and this is how it can help. And we have worked together and followed up and spent time every single visit just seeing how he is, how's he doing, how can we adjust, how can we readjust. And on top of that, he wrote a letter to the school saying this child needs testing, and by the next day the school had the testing in place and made it happen. Where I had struggled for a year to get that ball rolling, Dr. Lee took care of it, and now we not only have the medical needs addressed, the neurological needs, but he's also getting help in the school, which those are huge. The overlap of services that Shriners has provided has been amazing.
I felt like I can't do things, I might have to do these things the rest of my life. And after, like he can help me change things.
Did you get really frustrated easily? Yeah. How can you describe how that if you were frustrated about something, how that felt?
I felt sad, sometimes sad that some other people can do things that I can't do.
And then now you're getting help and you have a family support and your school supporting you. How does it feel to cope with certain emotions that you may have?
Happy, excited, cared and loved for.
What is it like coming here to the hospital?
Fun and happy.
Like people think, oh, you're going to a hospital. It's a hospital. It's sterile and there's, I don't know, there might be mean people there. How would you describe coming to Shriners and seeing Dr. Lee? What's he like?
Caring for other people, and he's funny and nice.